Okay, good morning Queensland. I'm happy to give the COVID update today. I know the Premier has already given some numbers, but I'll just go into a bit more detail. I'm here in Cairns today with the Chief Health Officer, Dr. Gerard, and of course our local member, Michael Healy, and we've got a great announcement to make, but first the COVID update. So as the Premier said, we've had 6,902 new cases overnight. 2,935 of those are rapid antigen tests, positive results that have been registered. Again, to Queenslanders, thank you very much for registering those positive results. And please, I encourage anyone who takes those tests or parents administering those tests to their children, please make sure that you are registering those in a timely way. So we've got that information in our system as well. As the Premier said this morning, it is very, very sad to announce 24 deaths. 24 deaths in 24 hours. This is a really hard day for particularly, of course, the families and loved ones of these individuals. As the health officer has said, some of these and many of these people have other underlying health conditions, but because at their death that they have also tested positive, we do report all of these deaths, but every one of them is, of course, tragic. We can report the ages are between 50 and 100, and 2 of those people were unvaccinated and only 6 had booster, and 16 of the 24 were aged care residents. It's good to see our hospitalisation numbers, so our public hospital beds are coming down with COVID patients from 663 down to now 628. We have the same number in ICU, 42, and the private hospitals we've seen an increase from 42 now to 58. It is great, as the Premier announced, to see our vaccination numbers. We have hit 90% double dose, so we are 92.22% first dose, which is great. That shows that Queenslanders are still coming out to get their first dose, and I really would love to see that number get over 95% of the Queensland population, 16 plus, vaccinated, and we have now hit 90.02% double dose. So that is great news. And our 5 to 11-year-olds, we're now at 39.87% and 59.28% on our boosters. And it's great to see our staff, our health staff and Queensland ambulance staff that are isolating and quarantining because of COVID is down even further today with the latest update, 2,148 staff. Now that's still a lot of staff that are off in quarantine or in isolation, but when we compare that to over 6,000 on the 18th of January, this is showing a real improvement in the community, and I hope it's showing an increase of staff availability across the private sector as well. So our distribution centres, our retail, supermarkets, all those businesses who are struggling with so many staff off on leave, we're hoping that now that we're coming off that peak, that more staff are becoming available to help improve our economy as well. And we have 534 children, so 5 to 17-year-olds who have tested positive in PCR results. So we said yesterday we'd start reporting these so we can see the trend and what might be happening with school returning. We don't envisage that this jump overnight is directly related to school yet because it's very, very early days and these are PCR results, but we'll continue to report them. I won't talk about our announcement yet. I'll hand over to the Chief Health Officer. We'll take questions on COVID and then we'll come back and make the announcement why we're here at Cairns today. Thank you.
Thank you very much, Minister. So sadly we have 24 deaths to report today, and I would remind you that we report anybody who has died who has had a recently positive COVID-19 test. Sometimes with the elderly who have multiple comorbidities, it is difficult to determine exactly what the cause of death is. But for the sake of transparency, we report anybody who has died who has had a recently positive COVID-19 test. And with COVID-19 being widespread in the community, we are seeing an increased number of these. So in the 24 deaths, there was one person in their 50s, 2 in their 60s, 2 in their 70s, 11 in their 80s, 7 in their 90s, and 1 aged over 100. 2 of these people had not been vaccinated. 1 had had a single dose. 12 had had just 2 doses, and we know that in the older age group it's that 3rd dose which is particularly critical in preventing severe disease. 6 had had a booster, 3 doses, and we don't have data for 3 of the 24. 16 of the 24 were in residential aged care facilities. That brings the total number of deaths in residential aged care facilities in Queensland to 176. And the total number of deaths in this Omicron wave has been 325. So again, our thoughts very much with their family and their friends. In terms of the impact on hospitals, here we have much better news. The number of patients in Queensland public hospitals continues to fall. 628 in the last 24-hour period, down from 663. We peaked just close to 1,000 on the 25th of January in terms of inpatient beds. So that continues to fall. What I'm sort of interested to see is when all hospitals have just a single ward where they're looking after COVID patients. There are still about a half a dozen hospitals in Queensland which require more than 1 ward to look after COVID patients, including here in Cairns. Cairns has been one of the regions most hard hit by COVID-19. Perhaps for a number of reasons, both in the First Nations community but also in the broader population. So there has been a significant number of COVID-19 admissions here to the Cairns Hospital, but I am pleased to say that the number has declined in the last 24 hours. It was 70 yesterday and has declined to 59 today. 4 patients here in intensive care unit, 3 of whom are ventilated.
Dr. Gerard, sorry.
No, go ahead. No, that's fine.
How comfortable are you with the rise of cases in schools? I know one high school had just 6 in the last couple of days. Is that concerning?
Oh, we will expect ongoing cases within hospitals, within schools in the coming weeks. In fact, we know we've been looking at the data of infections in children between the ages of 5 and 17, and there was actually quite substantial transmission in children between the ages of 5 and 17 3 weeks ago, around about the same time when we saw that wave in young adults. There was a lot of transmission actually in children at that same time when we analysed the data yesterday. I can tell you that across the state there were 295 new cases in children aged 5 to 11 diagnosed yesterday, and 239 diagnosed in children aged 12 to 17 yesterday. The point is most of these cases are very, very mild. They're no different to any other respiratory illness that any parent would be familiar with. But it is important that children who have any sort of respiratory illness continue to get tested, either using the PCR available through the public hospital system or using RAT tests, which will be becoming increasingly available in coming weeks, so they can isolate from other children. But as we've said on numerous occasions, the vast majority of children who get infection have mild illness.
Have you seen the modelling yet for what peak we might see when international borders open? What are we expecting there?
I don't expect there'll be a significant impact on the number of patients, the number of cases we see. The number of international arrivals is very small compared with the number of cases we've seen in the population of Queensland. We think so far, by the end of February, it'll be somewhere between at least 1 to 2 million Queenslanders that will have been infected by this virus by the end of this month, is what we think. So it's very large numbers of people have been infected. Many people don't even know they've been infected. Most have had a very mild illness, but it can, as we know, cause severe illness in some people, and it's more commonly causes severe illness in older people, but it can randomly affect young people as well. But we know for the most part it is a mild illness similar to flu, particularly, and I must emphasise this, and perhaps I haven't stated this clearly enough, particularly if you are vaccinated. If you are vaccinated, then it is likely that whatever illness you have will be mild, particularly if you're otherwise fit and well. There's a lot of talk about Omicron being a much milder virus than the previous strains. That's actually not true. The severity of illness associated with Omicron's very similar to the severity of illness associated with that initial virus that caused devastation in Italy and New York at the beginning of the pandemic in 2020. The reason why we have seen relatively small numbers of intensive care admissions, hospital admissions and deaths is absolutely because of the high level of vaccination we're seeing in Queensland, with now 90% of Queenslanders double dosed. But it is critical, and this is something is becoming very apparent, that particularly in the older age group, they need that third dose to give them protection. And anybody who has had their vaccine more than 3 months ago should get that third dose as well.
Now that we've reached that 90% mark, when will we potentially start to see restrictions eased, like mask wearing and distancing?
Look, at this stage, there are only 3 major restrictions on Queenslanders at the moment. There are not major restrictions on us at the moment. The only 3 things we have are indoor mask wearing, vaccination requirements for people in places like pubs and clubs and stadiums, and isolation and quarantine if you're sick. These in my mind, are not particularly onerous restrictions. Obviously, we continue to look at them as we head into winter, but the restrictions on Queenslanders at the moment are really quite mild, and Queenslanders can go about their daily lives as normal at present.
With the pressure that's then now starting to be eased in hospitals, as you said, with more staff being out of isolation, when will we start to see more of those elective surgeries be coming back on board? Yeah,
our plan is still that we keep the elective surgeries restricted until March, but it gets reviewed on a weekly basis. I will be more comfortable once we have just single wards in hospitals dedicated to COVID-19 patients, and there's at least half a dozen major hospitals, including here, Cairns Hospital, that have more than one ward requiring to look after COVID patients, and that is quite disruptive to the normal flow of hospital work.
And with that vaccination check-in requirements, is there any talk about that being updated to those 3 shots?
Not specifically at this stage. I mean, there's a lot of discussion around this 2 shots versus 3 shots, but there's no specific decision being made about that.
And with Novavax now in the country, what percentage of double vax do you think the state can achieve?
Well, we should at least be able to achieve the number of vaccinations that have already received 1 dose, which is, I don't know if the Minister can help me here, I think it's about, is it 92%?
92.
About 90%, 92% at least. 92% at least, but hopefully higher.
What do you say to some of those people who have been holding off getting vaccinations, waiting for the Novavax? Is that a wise thing to be doing?
Well, the vaccines we have are extremely safe and extremely effective, and we've got billions of people to prove that around the world. But if people particularly want to get the Novavax, it's coming here, so if that's what they're holding out for, go ahead and get the Novavax. It's not necessary, but if that's what people want, then there are some people who particularly wanted that vaccine. But we know that we have vaccines that are extremely safe and extremely effective. It's been proven among billions of people who've received them.
Okay, any other COVID questions?
Maybe for
Just for the Minister, please.
Yep.
Minister, what's being done about the 5% of hospital staff that are sitting at home on full pay who've been refused to be vaccinated?
So there's a number of people who have put in for exemptions, and some of those are complex around medical circumstances. So there is a small percentage that are still being worked through. The majority have already gone through, so all those who already have decisions would be going through a show cause process. And at the end of that show cause process, if they have chosen not to get vaccinated, then they would be terminated as far as their employment, or, as some have chosen to do, left the employment themselves. But we do have to ensure due process, and those who have exemption applications that are outstanding, they are continuing to either be on leave, or some of them are being allowed to work from home in certain circumstances, so telehealth and those sorts of circumstances. But I want to see these applications dealt with as quickly as possible, but where people decide to exercise their right for internal reviews or external appeals, or going to the Industrial Commission for review, they have every right to do that, and obviously we have to ensure that they are still employed by health while that process is ongoing.
And when will that be, given that the mandate has kind of come and gone months ago now?
Well, as I say, I expect that most of these will be finalised very quickly, but those who are going through review processes and appeals, especially through external bodies, we don't control those timeframes.
And now that the government, the state, has reached that 90%, do you think the government will review the roadmap to allow the unvaccinated into sporting events, clubs, hubs, etc.?
Well, we're constantly looking at the circumstances, but as I said a couple of days ago, school has just gone back. We have asked people to go back into the workplace. This will lead to an increase in transmission again. The Prime Minister announced yesterday international arrivals. All of these things will see transmission happening. We just need to do this carefully. As the Chief Health Officer has said, there's very few restrictions in place, but those mandatory vaccination rules around high-risk settings are there for a reason, and I believe have contributed significantly to the positive results we have seen in Queensland, where we have had less cases, less hospitalisation, less people in ICU and less deaths. And that is because of the measures we've taken and the decisions we've made over the last 2 years. So we'll continue to follow the health advice and do this carefully and not remove all restrictions at once, just at a time when kids go back to school and everyone goes back into the workplace.
The ADF personnel that are currently in some of the aged care centres, can you explain what exactly they're doing? And there are some people that have been concerned about the staff, the ADF staff, potentially traumatising the patients by having a bunch of soldiers suddenly in aged care.
Look, I would hope that would not occur. I mean, look, our Defence Force, let's remember, our Defence Force are just everyday citizens in our community who are doing an incredible job serving our country. And from time to time, they step in and help us at a domestic level as well. I have no doubt that they will go in and do it in a very compassionate, caring way, but there is help needed in these aged care facilities. Now, what exactly they're going to be doing, you need to ask the Commonwealth. The Commonwealth have sent the Defence Force in, they're responsible for them. But I have no doubt, based on the information that's been passed on to me by staff, by family members, they are concerned that there's not adequate staff there to cook the meals, to make sure that residents are being served on time, that they're getting healthy meals, that they're being checked on in their rooms regularly, they're being cared for. So, I welcome the decision that's been made. We wrote to the Commonwealth over a week ago proposing this. We've been talking about aged care for weeks. In fact, we've been talking about aged care and vaccination rates since the start of last year. And so I am concerned that not enough people, not enough aged care residents have had their booster. I do call on family members, if you can, keep asking those facilities, when are the teams coming in? And also, if you are able to take your loved one out for the day, certainly you could walk in and get a booster at any one of our clinics, or of course at a community pharmacy or a GP, because we know the boosters make a difference, and sadly we know that aged care residents are making up a large number of our deaths from COVID.
Of those 15 deaths in Cairns, aged care, in the Cairns region, how many have been attributed to death in aged care facilities?
I'd have to get that breakdown for you, but I'm sure I can get that information for you.
And what aged care facilities do you think these military personnel should be deployed to?
Oh, look, there is a very large number of facilities that I understand, the private residential aged care facilities that have outbreaks right now. What the Commonwealth needs to be doing, and the quality assurance regulators need to be finding out the level of outbreak, the staffing numbers, and going into any facility that is not able to bring in relief staff and to ensure that there is adequate care being given to those family members. Now, I saw a report yesterday that I believe at one centre, families have been asked to come in and volunteer. and the families are stepping up and doing that, and that is wonderful. But it shouldn't be reliant on just families volunteering to care for their loved ones in a paid aged care setting. They should be reaching out to the Commonwealth and asking that those centres have those Defence Force personnel there urgently.
And Minister, on Monday we had the Health and Environment public hearing here, and we heard from a JCU professor who said that she has a nursing student doing professional placement, living out of a tent because they're unable to get accommodation. If we're trying to support more people to enter the healthcare sector, should the Queensland Government look at helping out with some of those accommodation costs associated with those professional placements?
Sure, and we do that. So there's a range of initiatives. There's extra payments that go to people who work in certain remote and regional towns across Queensland. We have accommodation being built, student accommodation. Even when the Premier and I were out at Roma last year, we saw accommodation being built there. So we are building new student accommodation. I've seen it for myself where we're doing that. We'll continue to look at the issue of housing. Housing is a major issue. Housing is a major issue in attracting people to work in regions, whether it's education, whether it's health, right across the sector, but also the private sector as well. We know that housing shortage, and with COVID and the massive influx we have seen from people interstate now moving to Queensland to call Queensland home, that is putting further pressure on both rental availability and being able to purchase affordable homes. So these are complex issues. We have put in a massive investment as a government into housing in last year's budget. This is a problem that the Commonwealth needs to step up and help with as well as far as housing. The National Rental Affordability Scheme ends very soon. This was a federal Labor initiative that built these accommodation that kept it affordable for those most in need in our community, and that ends very shortly. And I am very concerned where these people are going to go if overnight their rental gets significantly increased. So yes, it is an issue. I welcome any submissions, anyone coming forward, putting forward ideas in the parliamentary inquiry. We want to see positive things come out of this inquiry. This is about finding out where the gaps are and working with the Commonwealth as to seeing real investment where it needs to be to boost health right across the state, including our regions.
How accurate is reporting in schools? Is this information getting back to parents of those individual schools?
Of
cases, COVID
of cases. Well, each school will deal with any outbreak, but of course they work with the public health unit. So what we've said is if there's an outbreak in the school, that information is provided to the public health unit. The public health unit will work with the school as to whether there needs to be isolation or quarantining on individuals. Obviously, the positive individual students would have to isolate, but whether a whole class or a whole school needs to quarantine, those are things that are determined on a case-by-case basis with the information that the public health unit has. We've handled this really well through the outbreaks last year, where initially we were having to close whole schools, and with the way that we managed it, we got to a point that we were only having to quarantine a classroom and individual students' closest friends as opposed to whole schools. So the public health unit will make those decisions and work with the school, and the school will work with the parents to share that information.
But masks are only mandatory for high school students. Do you think that will change anytime soon for primary school students?
We have said we strongly recommend it from year 3 up. But we understand that not every child's going to be comfortable with that, and it has to be managed in a safe and sensible way in the classroom. But certainly we have strongly recommended it for primary school kids as well.
And the families of the Jeddah aged care home met last night and the meeting got heated. What will the government do to help the aged care crisis?
Look, we are doing what we can. When aged care facilities reach out to us, when peak bodies reach out to us, and when the Commonwealth reaches out to us, as they have numerous times and asked us to provide PPE or rapid antigen tests for these aged care centres because the Commonwealth can't get it to these facilities quick enough, we've stepped in and helped them. We've been asked to help source staff and also private hospital beds for the Commonwealth for aged care. So we have certainly been engaging with the Commonwealth and facilities on this, but ultimately we do not have the authority to just walk into any private residential aged care and take control or impose any changes to their practices, whether it's infection control or staffing. We don't have the authority. The Commonwealth regulates, the Commonwealth funds. The Commonwealth is the one who is responsible for private residential aged care, and where we can help, we will. And I know a number of my hospital and health services are reaching in and helping aged care facilities right now.
And when the international borders do open on the 21st of February, will there be any plans to introduce more restrictions?
Not at this stage, no. As the Chief Health Officer has said, we already have widespread transmission happening in Queensland and across the country. I don't believe that the increase in international arrivals will really change that. It may mean that if there's a new variant out there, that the new variant will get here quicker by more people coming in. But we're prepared for that. We have dealt with many different variants. We've dealt with Delta. We're dealing with Omicron now. We will deal with whatever comes next. But what we do know is that getting vaccinated will help prepare us for that next variant that comes on our shores and those continued high level of cases. Remembering our surveillance testing a few weeks ago on the Gold Coast of random households showed 1 in 6 people are positive with COVID. So we should assume that could be the case anywhere in Queensland. That when you're standing in a room, we have, a dozen or more people here right now, there is a possibility someone's got COVID and not even know it. So that's why the masks are important. That's why the mandatory vaccination rules are important. And that's why it's important to keep testing and isolating and quarantining. Now, we might move on to our announcement here today. So I'm thrilled to be here. We might just invite some of our representatives from Hutchinson, also our hospital health services here. I've got Tina, our Chief Executive, and Clive, our board chair, and great representatives from Hutchinson who have been successful in winning the contract here. We are here next to the Cairns Hospital doing a sod turning on the new mental health facility. This is a $70 million investment, 3-storey mental health facility that will see 10 mental health ICU beds, as well as another 43 beds for adult acute mental health. This will be a real benefit not only for mental health, and this is being co-designed with a lot of consultation with consumers, with stakeholders, to ensure we get this model right. It's got to be safe, it's got to be sustainable, and it's got to be culturally appropriate. And yes, it has been delayed, and there's been a lot of extensive consultation. There's been delayed due to COVID, but I am so pleased we are here today to finally be able to turn the sod, to announce Hutchinson as the successful builder, to know that at the end of next year, this construction should be completed in early 2024. We will see this facility becoming operational. And with this facility becoming operational, it frees up space in the Cairns Hospital, which will allow us to put another 32 surgical beds in there. And that is more elective surgery, planned surgery, and that is fantastic. So it's not just helping with mental health, but it's also helping see those people on waiting lists getting their elective surgery sooner. And also during the construction, it helps our economy. It'll see the equivalent of 70 full-time jobs during the construction phase as well. So I'm really thrilled to be here with Michael Healy, and Michael has been in my ear on a weekly basis about this. So I'm thrilled to be here with Michael today doing the sod turning, and we'll also hear from the Clinical Director of Mental Health Services here as well, just about the work that's been involved in designing this and what this wonderful facility is going to contain. So I'll hand over to Michael and then we'll hear from Mike. Thanks.
Thank you very much, Minister, and good morning everybody, and those of you that aren't from the great city of Cairns, welcome. I'd like to firstly just begin by acknowledging and passing on my congratulations as the elected representative of the people of Cairns, everybody that's working in our health, not just here but across the state. We know it's an enormously challenging time. I personally have friends that work in the hospital next to us, so I want to acknowledge the hard work that they continue to do and the pressure that they're under, and that extends from the executive all the way through. And I am so pleased to be standing with the Minister here today to be talking about what is vitally important, and that is an upgrade to our mental health services. This is part of an overall upgrade, that a commitment that the Palaszczuk Labor government has given to the people of Cairns and to our region. As we grow, we know that we need this important infrastructure. So to see these 53 additional beds And as the Minister touched on, it allows further improvements into the existing hospital. We need to get more beds, and there are future plans for that. So this is the first step. Vitally important, we know that COVID has been absolutely significant and the impact has been detrimental up here in this part of the world. So to see a project of this size, $70 million, coming off the end of the $176 million being spent on our convention centre, it is vitally important from a jobs perspective. So this is really, really important. And I know there are a lot of people who've been waiting for this announcement. So I'm very, very pleased to have the Minister here to make this announcement. I congratulate Hutchinson's on their securing of this contract. We know they do good quality work. It's important for our community, it's important for our economy, and I just want to say thank you very much. And now I'll hand over to somebody far more qualified who can talk to you about the details of the facility.
Thank you, Minister Healy. And so my name is Mike Turbot. I'm the Clinical Director of Mental Health up here in Cairns. Obviously, we're hugely excited about this work commencing. It's a vital piece of infrastructure for this hospital, for the region, and it's fantastic that the Minister could be here today to mark this occasion. We know that mental illness affects about 1 in 4 of our community, and it's not just about infrastructure, of course, it's about a community and healthcare response to support people in need. But we also know that a small percentage will require hospital level care and tertiary level care, and it's hugely important that we have an access for those people who need our services. So we hope that this infrastructure will not only provide inpatient beds, but a pathway from community access through to inpatient beds. We envision that this will set us as leaders in regional mental health care. We're hugely excited about the doors opening. 2 years is not too far away. We've got a lot of work to do in the interim, and we're just keen to see it kick off.
Are you disappointed, given the $70 million investment, there's only going to be a marginal increase in the bed capacity?
So $70 million is not a small investment. We're hugely excited. 5 beds is actually a lot of beds. We function currently on 48 beds, and for the vast majority of the time we function within our bed space. We were benefactors of an interim ward and new infrastructure up on D6, so we've been using that space in the last couple of years. We've also got an AOD facility, youth resi facility coming on board, hopefully in the next 12 to 18 months. And we've had recent builds in youth step-up, step-down facilities. So it's not an insignificant investment, and, vitally important. And 5 beds is a lot of beds. And as the Minister has pointed out, it frees up other beds in the hospital as well. So.
But would it have been nice to have had more beds than like the additional beds that we're getting now?
Yeah, I mean, it's always nice to have more beds, but we also understand that a lot of the work we do is in the community. So the vast majority of people requiring mental health care, the work is in the community. We need to bolster our community services. This infrastructure goes some way towards that, so it's not just about the beds, it's about the infrastructure on first, second and third floor to support access and our centralised intake service, and so on and so forth. So it's not just about the beds. I hear you. Beds is always under pressure, and we like the addition, and we will always ask for more, of course, but we think we're in a pretty good place.
For a patient needing these sorts of services, what's the difference going to be in terms of their experience in 2 years versus now?
So currently we are following the demolition of our old unit. We operate on 4 wards across 2 parts of the hospital. As I say, the interim ward of 20 beds was built, so a lot of money went into that interim facility, but it isn't a purpose-built mental health unit. It doesn't have all the mod cons, the Wi-Fi, the views of the Esplanade, and the light and gyms and OT facilities that come with a purpose-built mental health unit. So we envision that it will be a far more therapeutic space than what we can currently offer.
And what can that mean for patient outcomes?
Well, mental health consumers, like any other consumers of a health service, deserve the very best in healthcare, and this is the newest facility in the region, and we hope we will deliver the very best level of care, and that includes sensory rooms, it also comes with, there's models of care behind the infrastructure as well. So we're always looking at ways to improve delivery of care and evidence-based medicine care to mental health consumers.
It was mentioned before as well of the consultation and culturally appropriate care. How is that going to be tied in with the new facilities?
So you're absolutely right. So a lot of stakeholder consultation over a couple of years and ongoing around the design, the views out to sea and community, the space and the lighting. Mental health is a very difficult space to design, but we've definitely had consultation all along the way around how we can make that culturally appropriate, and I think we will deliver on that, and I'm confident our broad community will be satisfied with the outcome.
And the Cairns region topped the state for the highest suicide rate. Is this then too late? And I guess what needs to be done in the interim to sort of make sure that rate is managed and people are able to access the care they need while we're waiting for this facility to be open?
So any suicide is a tragic outcome, and it is true of many of our regional and remote areas that the suicide rates will be higher than the metro centres, and that a lot of that relates to access to care. And so when we have this level of expenditure, and when we have the infrastructure and the models of care combined with the suicide work that we do with our community partners, GPs, NGOs and otherwise, all of that is driving towards reducing the very worst of outcomes, which is suicide outcomes.
And this facility will be open to everyone of all age groups, including children and teenagers?
So no, it's an adult facility, but we have designed the unit in a way that will be flexible. So there is, the infrastructure will allow for cohorting of clients, protecting against those most vulnerable, but it is not an adolescent unit, for example, if that's what you're asking. Our adolescent unit remains in Townsville. We have growing numbers of consumers who do require adolescent level inpatient care, and we are in constant discussion around how we can best meet that needs. I think the hospital does a fantastic job of flexing our beds and flexing our staff to delivering that care, but we still utilise the Townsville mental health unit when young persons with mental health require inpatient level care.
So into the future, you're going to think about introducing an adolescent one here in Cairns? I know they're vulnerable members of the community.
It's an active discussion. As I say, we recently built the Youth Step Up, Step Down facility. We have plans in place to build a youth resi AOD facility, alcohol and other drugs facility, and of course we're looking at how that can be supported with inpatient beds. But as I say, the hospital is, we have a team that is dedicated to managing child and youth patients within the hospital when that need is there, and we are always in conversations around how we can best meet those needs.
Will some patients be coming from across Cape York and the Torres Strait? Are you taking in patients from that whole region?
Absolutely. So the Cairns Mental Health Unit services an area the size of the UK. So we are the hospital point for a massive region. I think we've got something like 53 community mental health hubs, and when someone requires inpatient level care, Cairns is where they come to. So we have Cape and Torres have their own mental health teams, but we have outreaching medical officers, and we frequently admit, not frequently, but fairly often we will admit consumers from Cape and Torres as required.
Do you hope that at some point there'll be more inpatient facilities up in those regions so that people can get that sort of support on country while they recover?
Care close to home is clearly important, but building, for example, inpatient beds is a big infrastructure expense, and could that expenditure be better placed in supporting communities? These are constant discussions. I don't think there's any plans to build inpatient beds up in the Cape and Torres at this point in time, and we will continue to work hand in hand with Cape and Torres to deliver the best care for those consumers.
I might just ask the Minister a quick question if you don't mind.
Last question, then we'll turn this on.
Minister, just quickly, you mentioned delays. This facility was supposed to be opening now. Was this project put on the back burner in the last 2 years?
No, nothing's been put on the back burn. We've been working through a range of issues, including extensive consultation to make sure we get the planning right for this facility, because it's not just about the number of beds, it's about the holistic approach to mental health. It is about having a much safer, culturally appropriate surroundings as opposed to what is your traditional hospital bed ward and hospitals. We know that even with emergency departments, mental health is, coming into an ED when you're having a mental health episode is not the best environment. That we're building more and more specialist mental health ED waiting areas that are more appropriate in the circumstances. So, look, COVID has certainly led to delays in a lot of our planning as well. I'm just glad we've got to this point now. We have the contract awarded. We've got Hutchie standing behind us right now. This is going to start construction and by the end of next year we hope this will be completed and we'll be able to operationalise it. And again, when we talk about 5 extra beds, we're really talking about 37 extra beds because it's 32 surgical beds that are going to be able to be created in the hospital, as well as the extra mental health beds, and that's going to be a huge benefit for the hospital and the whole community.
Excuse me, isn't it an embarrassment to your government that we're standing here on a vacant lot where there should be it's built now?
No, I just explained that, sometimes there's delays, that, it's difficult. Of course, we would have loved to have seen this already constructed, but we are where we are now. We're getting on with it. There's been a lot happening over the last 2 years, a lot that our hospital system and the health sector's had to deal with, and I'm just glad that we've been able to get the planning done, get the contract awarded, have the design done with extensive consultation and be here today to start construction.
Thank you.
Thanks, everyone. Now,